Hello everyone, I am Dr. Kalen, and in this video, I will illustrate some of the complications associated with sleeve gastrectomy. This presentation is not intended to be exhaustive, so please discuss these matters with your surgeon before proceeding with any operation. A sleeve leak is a complication that may occur when the staple line fails to heal properly, leading to the leakage of ingested food or digestive secretions from the operated stomach. This complication will require additional interventions and a longer healing period, causing inconvenience for the patient. If not addressed promptly, it could have serious consequences on your health and become life-threatening. Therefore, rigorous follow-up and reporting of any issues to the surgeon, along with strict adherence to the recommended diet and other instructions, are required. Bleeding from the spleen, bleeding from the stomach staple line, bleeding from the liver, or bleeding from any other areas that were manipulated during the surgery. Bleeding can occur as a complication of any surgery and may vary in severity, ranging from minor instances that stop spontaneously to those necessitating interventions such as coagulation correction, blood transfusions, or surgical procedures to control the bleeding. Severe bleeding, if not addressed promptly, can become life-threatening. Stricture or narrowing of the sleeve can develop either immediately after surgery or over time. This condition may result in patient discomfort characterized by symptoms such as vomiting, heartburn, significant weight loss, and malnutrition. Severe narrowing of the sleeve requires attention and may necessitate additional interventions such as endoscopy with dilatation or surgical procedures. In some cases, converting to bypass surgery might be the only viable solution to address this issue. Gastroesophageal reflux is a condition where stomach contents, particularly acid, flow backward into the esophagus and sometimes regurgitate into the mouth. This condition may arise as a new issue after surgery or exacerbate a pre-existing condition that existed before the surgery. Typically, achieving a normal weight after bariatric surgery is associated with reduced reflux. However, if reflux persists, acid medication may be necessary. In severe cases, a bypass procedure might be required to alleviate this condition. Additionally, occasionally, bile from the intestine can follow a similar course, leading to bile reflux. Following a sleeve operation, there can be instances where the upper part of the stomach becomes displaced into the chest, leading to a hiatal hernia. This condition can result in discomfort, acid reflux, and difficulty swallowing food. Ultimately, surgical intervention is often necessary to repair the hernia. Furthermore, it's important to note that injuries to any of the intra-abdominal organs could theoretically occur as a potential risk associated with the surgery. Specific interventions tailored to each case may be necessary to repair these injuries. Injuries to the large intestine, injuries to the small intestine, injuries to the pancreas, injuries to the liver, injuries to the spleen. In extremely rare cases, the removal of the spleen may be necessary to control bleeding. Injuries to the esophagus and the stomach. Occasionally, stomach ulcers may develop due to poor healing, particularly when patients resume smoking after the surgery. Following the postoperative recommendations, abstaining from smoking is crucial, alongside taking acid-reducing medication in the first couple of months following the surgery. Additionally, a commitment to regular follow-up appointments for surveillance and evaluation by a gastroenterologist, often involving endoscopy, is essential. These steps are crucial in preventing such problems, and if they do occur, they can be appropriately treated. Portal vein thrombosis is a condition that can arise from blood clots traveling to the liver and obstructing the venous supply. This blockage often causes abdominal pain, necessitating immediate medical attention. If a patient experiences abdominal pain, it's crucial to seek emergency care promptly. Preventing and treating this condition typically involves administering anticoagulation to the patient, both before and after the operation. If left untreated, this condition can potentially become life-threatening. Blood clots can also form in the veins of the legs, potentially traveling to the lungs and causing a pulmonary embolism. To prevent these clots, patients receive anticoagulation medication. Additionally, special boots are placed on the calves during the hospital stay and surgery to assist circulation, while intravenous fluids are administered for hydration. Patients are also instructed to maintain adequate hydration after discharge and to stay active and walk in order to minimize the risk of clot formation. Treating blood clots requires anticoagulation, as they can pose a life-threatening risk if not managed properly. Patients should seek emergency medical attention for symptoms such as chest pain, shortness of breath, and leg swelling, which could be early signs of developing blood clots. Once diagnosed, immediate anticoagulation treatment will be initiated. Typically, a routine sleeve gastrectomy involves making 4 small keyhole-sized incisions in the stomach. However, in certain cases, particularly when the liver is enlarged, a 5th incision may be required to improve exposure during the surgery. Adhering to the pre-surgical low-calorie diet can help reduce the size of your liver, significantly decreasing the likelihood of needing the 5th incision. In extremely rare situations, unforeseen circumstances during surgery may necessitate the use of open surgery. If this occurs, the surgeon will make a vertical incision in the middle of your stomach to perform the operation. Any surgery involving incisions on the abdominal wall could potentially lead to hernia formation in the future. The likelihood and size of a hernia developing often correspond to the size of the incisions. Smaller incisions typically have a lower risk of causing hernias, and if they do, they tend to be small in size. Conversely, larger incisions are more often associated with the development of larger hernias. Vitamin deficiencies are possible following sleeve gastrectomy. Close follow-up with the dietitian, primary care doctor, and bariatric surgeon is crucial to prevent this. It's important to adhere to the instructed intake of vitamins and other supplements. Your healthcare providers will schedule regular blood tests to detect any abnormalities and ensure your well-being. Mineral and trace element deficiencies are possible after sleeve gastrectomy, such as low iron leading to anemia or low calcium levels. Prevention through supplementation is key, and prompt treatment is necessary if deficiencies occur to avoid potential consequences. In extremely rare cases, severe weight loss accompanied by protein and calorie malnutrition could occur. To prevent this complication, maintaining close communication with the bariatric team and promptly reporting any issues or concerns to them is crucial. Rapid weight loss following bariatric surgery can, at times, lead to the formation of gallstones. If gallstones develop in the gallbladder, you may require gallbladder removal surgery. Some medications can help prevent this, and your doctor may prescribe them after the surgery. However, if you experience abdominal pain in the months following the surgery, it could be a sign of gallstones, and surgery to remove the gallbladder might be necessary.